Hello friends, welcome to the QRP session. And in this particular session, we will be mainly dealing with epidemiology and its related topics, which include mainly first 4 chapters in your standard textbook. That is mainly the concept of health and disease. Then we have the principles, general principles of epidemiology, then screening and diagnostic tests, and also about the first chapter, history of public health. So we'll start with the most important chapter, which is principles of epidemiology or general principles of epidemiology. So let's see what is epidemiology. Guys, it's very simple. As the name indicates, epi means upon, demi means people, ologos means study. Yes, you are studying people. We doctors study people, right, who are diseased. Now, how is it different from what a normal doctor is doing inside a clinic? Inside a clinic, the doctor is studying one single patient, right? Whereas an epidemiologist, he's studying a group of patients with one particular disease. So my question is, when you study a group of patients with one particular disease, what are the aspects that you are planning to find out? Mainly 2 things, both are starting with D. One is distribution, or simply the clinical features of the disease. Now, why you want to know about the clinical features unless you know the clinical features? See, we know that a lot of clinical features are possible with any disease you take, which you will not be able to find out if you're studying one single patient, right? So you want to study many patients so that even without missing a single clinical feature, you should be able to identify every clinical feature possible with one particular disease. And the second, again starting with D, which is determinants. As the name indicates, these are those factors which determine the occurrence of the disease, or simply risk factors. Now, tell me why you want to know about the risk factors. Unless you know the risk factors, you will not be able to control the disease, and you want to prevent the occurrence of same in future, right? And that is what an epidemiology is. It's a study of distribution and determinants of a disease in a specified population, and you're applying that knowledge to control the disease in future. Okay? Now, let's go further. See, whenever there is a disease outbreak, usually a team from WHO or sometimes from CDC or sometimes from the central government, they visit the outbreak affected area to study about the outbreak, right? Especially when you have a new disease like Nipah or COVID, a team usually visit that area to study about the outbreak, right? So my question is, what are these people studying? If you know what these people study, that covers the whole of epidemiology. That is why I'm asking. Okay. They mainly study 3 things. First, they want to know whether it is a serious problem or not. Because, you get to know about all this from media, and media people, they usually inflate anything and everything they get, right? So first you want to know whether it is a serious disease or not, or whether it is a serious problem or not. For that, they want to know how many people are actually affected with the disease, or just a media hype, or in epidemiological terms, you call it as frequency. Okay. Second, you want to know what are the clinical features that is found in that particular population, or the distribution. And the third is the risk factors or determinants. I hope you're with me. This is what you study, right? How many people are affected? What are the risks? What are the clinical features? And what are the risk factors that has led to this disease? Because till yesterday, this disease was not there. These people were there, but this disease was not there. All of a sudden, what is actually happening so that you're getting an outbreak, right? So these are the things that you study. And distribution is usually measured under 3 headings, which is again another MCQ: person, place, and time. Person means who are the people affected with disease. Is this disease mainly affecting children, adult, males, females? Because we know that certain diseases have got its own preponderance, right? Then which place is affected with the disease? Is this disease mainly affecting urban area, rural area, coastal area, tribal area, like that? And time means, as you can guess, is there any time specification, like, certain diseases are seen during rainy season, certain diseases are seen during summer season. So when you simply study the distribution, time, place, and person, that itself will give you a clue about the risk factors that could have led to the disease. Okay, especially you are dealing with a new disease. Okay, so you will get an idea, okay, these could be the risk factors that could have led to the disease when you simply describe the distribution in terms of time, place, and person. Okay? Now, I want to ask you a question. We are studying about epidemiology, right? Who is the father of epidemiology? Any idea? He's a doctor. I'll show you his picture. This person is the father of epidemiology. Who's that? This is Dr. John Snow. He's known as the father of epidemiology. And what did he find out? Using epidemiological methods, he found the reason behind cholera outbreak, right? Till he did his study in London, it was believed that cholera was mainly caused by, they thought that, the whole, I would say the scientific community were believing that cholera is because of bad air. You call it as miasma theory, right? Okay, so he is the first person who actually studied about the risk factors behind cholera by studying, time, place, and person, about which the whole story, everything I have dealt in the original video. I will not be going into that story part. Anyway, he's the first person who identified the risk factors behind cholera, which is water, right, and not miasma, because of which he is known as, that means Dr. John Snow is known as the father of epidemiology. Okay, moving further. See, I told you in epidemiology, you are mainly studying three things, right? One is frequency. How many people are affected with the disease? Second, the distribution. And third is the determinants or the risk factors. So let's start with the first one, frequency, and see what are the MCQs from frequency. Okay, see, I said in frequency by counting. Frequency means what? Counting, right? 1, 2, 3, you're counting. So by counting the number, you're trying to find out the problem of that particular disease and is it a real problem or not. So my question is very simple. If you want to know whether this disease is a real problem or not, or just a media hype, what all you need to count? If you want to know whether the disease is serious, what all things you need to count? We know that Nipah is a serious disease, right? Whereas COVID is, nowadays, it's not that serious. Why? Because the number of deaths are more with Nipah. So what is the first thing that will help you to know whether it is a serious disease or not? Mortality. So under frequency, you count mortality first. Everybody is not dying, especially in COVID. Nowadays, after the vaccination, nobody is dying, right? So, but they have the problem. So what is it? Morbidity is the second thing. Or any deviation from normal health you call as morbidity. Then you have the third one, disability. Is that clear? So under frequency, you are counting the number of people who died with the disease, number of people who became morbid with the disease, and number of people who became disabled with the disease. Disabled means, inability to do a routine function. So they are, confined to bed, or they have some problem and they are unable to execute their normal routine. Okay. So this is what you are counting under frequency. And let's start with the next important one from within this, mortality. How do you count death? Now, death is mainly measured using 4 to 5 parameters. I'll just give you the name of those 5 parameters and we will discuss one by one. One is crude death rate, then you have specific death rate, then case fatality rate, proportional mortality rate, and survival rate. Each of this is an MCQ. Before that, let me tell you a brief introduction about this topic and the MCQs that you can expect. One, you have to identify these as mortality measures, right? Second, they have a formula, but don't worry. Those formula are very, very simple. Just listen. And you can also get problem-based question based on this formula. So these are the 3 types of questions that you can expect from mortality. So we'll start with the first one, crude death rate. Shall I give you the formula? Crude death rate means, guys, nothing to mug up. Okay. Crude means what? Non-specific. Okay. Crude means non-specific. It will only tell you out of 1,000 people living in an area, how many deaths occurred. So naturally, what will be the formula? Number of deaths divided by media population into 1,000. Okay. I hope you know what is media population. That is something that you have learned in UG. Media population means, as the name indicates, middle of the population or middle of the year. The population you have in the middle of the year, which is middle of the year. If I'm directly asking you, you may be giving me a lot of options, I know. It's just one day, which is, I hope you're able to read July 1st. It is July 1st, okay? If you're unable to read, let me write it properly. Okay, July 1st is the media population. Whatever I write here is an MCQ. It's a QRP session, so I will not be giving you unnecessary things, only the most important MCQs. Okay. So this will tell you out of 1,000 people living in an area, how many deaths occur. Now, why do you say this is non-specific? Because it will not give you any specific information like which disease is killing the people or which part is dying because of the disease, like whether it is killing small children or adult or elderly. Don't you think that such information is important? Just imagine that the crude death rate of India and one developed country are the same. That means per 1,000 people, the number of deaths are the same. In that particular developed country, let it be US or UK, there more elderly people are dying because of chronic conditions or elderly problems, whereas in India, small children are dying because of diarrhea and ARI. Though the crude death rate is the same, do you think the health status is comparable? No. So such subtle information will not be picked by your crude death rate. So we want the next one, which is specific death rate. This, as the name indicates, will specifically tell you which disease is killing the people or which part is dying. Okay, so what will be the formula? The change is going to get reflected in the numerator. In the numerator, we have number of diseases, deaths from a specific disease or happening in a specific group, which could be an age group or a sex group, divided by media population into 1,000. Okay, so simple, right? Moving to the next, proportional mortality rate. Guys, what do you mean by proportion? A small portion, right? Proportion means a small portion out of the whole. Okay, mortality means death. Then what would be proportional mortality rate? Out of total deaths due to all cause, what proportion is contributed by one particular disease alone? So what will be the formula? Number of deaths due to one disease in the numerator and deaths due to all causes in the denominator into 100. So naturally that will tell you what percentage out of total deaths is contributed by one disease alone. Is it not? You might be feeling that, oh, it's so simple. Yes, it's so simple. There's nothing like formula. I'm just showing you the formula, but that doesn't mean that these are something that you need to mug up. So simple. Okay. Moving further, you have case fatality rate. Now, what is case fatality rate? You know what a case is. What is case? You see a lot of case in IPU, OP, right? What is case? One particular disease is case. Fatality, death. So what would be case fatality rate? Number of deaths due to a disease. So what will be the formula? Out of total people who got a disease, how many died? The formula is number of deaths caused by one disease in the numerator. In the denominator, everyone who got that disease into 100. Right? So this is the formula. So that will tell you out of total people who got a disease, how many died. Okay. There are two very important MCQs from case fatality rate, which are, it will give you the killing power of a disease. Do you agree with me? Second, it is related to the virulence of the disease-causing organism. Both are very, very important MCQs, guys. Very, very, very important MCQs. Okay. Moving further, you have the survival rate. This is just the opposite of case fatality rate. Case fatality rate tell you out of total people who got a disease, how many died. Survival rate will tell you out of total people who got a disease, how many survived. And we usually calculate survival rate for 5 years, right? So what do you have in the numerator? Number of people who survived after 5 years divided by people who were diagnosed with a disease or people who were started on a particular treatment. So for calculating the survival rate of a treatment also, you can use the same formula, survival rate. I hope it is clear. So these are the mortality rates, and I'll show you a very, very, I would say a tough question which came for one of the exams. Not once, twice, 2-3 times this question came, and this is supposed to be a tough question because I'm showing you the tough question because whatever rest that you may come across in the exam is going to be much simpler than this. Okay. In an Asian country with a population of 6 million people, 60,000 deaths occurred during a year. Okay, some year. 30,000 deaths were from cholera in 1 lakh people who were sick with cholera. Find out the cause-specific mortality rate and case fatality rate of cholera. So simple, right? So this type of questions you can expect. Here, I'm just showing you the data they have given. I've just picked them from the question. Media population is given, total number of people in that area, total number of cholera cases, total number of deaths, and total number of cholera deaths are also given. Now, you're asked to find out cause-specific mortality rate as well as case fatality rate. What will be cause-specific mortality rate? Number of deaths from cholera divided by media population, which is 30,000 divided by, 60 lakh. So that'll be 5 per 1,000. And case fatality rate will be total number of deaths from cholera divided by total number of cholera cases into 100. So that will tell you what percentage died because of cholera. And the answer is 30%. Okay, so this will be the type of questions that you get. A tougher version is what I'm showing you. Okay, another very commonly asked MCQ is rabies is 100% fatal disease is an expression of which of the following? Of course, very, very simple. It is case fatality rate. Right? So these are the type of questions that you can expect from mortality. So I've told you what is mortality, what are the, in the small span, we have seen a lot of MCQs. The list, then the formula, and how to apply it. Shall I move to the next one? Morbidity. Morbidity is little more easier because there are only 2, unlike 5 you have in the mortality. Here you have just 2 in morbidity, 2 parameters to measure morbidity, which are incidence and prevalence. Okay guys, incidence and prevalence. Now, what is incidence? What is prevalence? These 2 will help you to find out morbidity. Morbidity means any deviation from normal health you call as morbidity. Okay, let me write it here. Deviation from health or normal health is morbidity. Now, how many people are having some morbidity around you that you can get from the hospital records and from the panchayat and from many places you will get it. Using that, you can calculate 2 things. One is incidence and prevalence. Now, what is the difference between incidence and prevalence? Here also you have a formula. You should know what is incidence, what is prevalence, and the formula. And you have to apply that here as well. Whenever I ask incidence, students tell me, Madam, new cases. Then what is prevalence? They say new plus old. Or I would write all cases. You are absolutely right. Prevalence means you're doing a survey and you're trying to find out at one point how many are having a particular disease. Okay, suppose I surveyed 1,000, 10,000, let it be 10,000 people I surveyed, and I found that out of 10,000, say 100 were having some disease. Let it be COVID. Now we are concerned about COVID. Then that will tell me per 1,000 people are you seeing? How many are having COVID at one point or today or this week? It is 10 per 1,000. This is nothing but prevalence. Okay, this is prevalence. So you can say that prevalence of COVID at this point is 10 per 1,000. Okay, whereas in incidence, you are calculating new cases. If you want to calculate new cases, you have to follow them, right? So here you are following those without a disease. Then you are seeing number of new cases, right? So how many new cases are happening over your follow-up time? Are you with me? So this is what you do to find out prevalence and incidence. So my question is, prevalence you get from which study design? We'll see that later. But prevalence, I said survey. Doing survey is nothing but, let me give that MCQ here as well. Prevalence you get from cross-sectional study. You've heard about all that, right? And I said, follow up the patient to know the new number of cases, which is nothing but incidence. And you get that from cohort study design. Don't ask me what it is now. We'll see that in detail. And you also might have learned it, I guess. Okay. Next, the formula for incidence and prevalence. Whatever I've written is an MCQ. Okay. Then, formula. There is an easy way to remember this formula. Prevalence. Look at the numerator. All cases here. All cases here. Yeah. That is a clue. A tip to remember. Okay. Then, incidence. How many N you see there? 1 N here, 1 N here. So it is new cases in the numerator. Okay. In the denominator, in prevalence, you have the total population. That means everyone who were present for the survey. And in the denominator of incidence, you have total population at risk. That means people who are susceptible to develop the outcome. Because you want to know, when you follow those people who are susceptible to or who are at risk for developing the outcome, how many actually develop the outcome. Okay. For example, suppose you want to know the outcome or the incidence of CA endometrium. You can't include males in the denominator, right? Okay, because they are not at risk. I hope the message is clear. Okay, so only those who are at risk of developing the outcome should be there in the denominator. Whereas in prevalence, the whole population you are putting in the denominator mainly. Okay, next, I'm going to show you a picture from which I'm planning to give you 4 MCQs from incidence and prevalence. See, P equal to I into D is another MCQ. By the way, what is P? Prevalence. I is incidence. D is, you might be wondering, what is D? Duration. As the duration increases, naturally, new cases, more and more new cases will develop, and that will get added on to the prevalence, right? And here, in this particular picture, I'm just zooming it. There are 4 more other MCQs. I'm just going to tell you what it is. Think about it. As incidence increases, prevalence increases, right? That's what I said just now. As recurrence increases, as in the case of ARI, it comes repeatedly, right? Then prevalence increases. As mortality rate increases, again, prevalence, what happens? Decreases. That is exactly why the rabies cases, we have a lot of rabies cases, but when you take a survey, you won't find even a single case. Why? Because they are dying within a week, right? Similarly, cure rate. If you take the case of chickenpox, cure rate is fast. If you take the case of measles, cure rate is fast. So as the cure rate increases, naturally the prevalence decreases. I hope it is clear. Okay, so these are, again, I would say, when you count 5 MCQs. Okay, next is secondary attack rate. Secondary attack rate. Now, what is secondary attack rate? Look at this picture. That itself is self-explanatory. From the first patient who got the disease, how many others develop the disease? Okay, so here also you have a formula. The formula is number of exposed susceptible people who are developing the disease within 1 incubation period divided by total number of exposed susceptible people. Okay, and another thing that you have to keep in your mind is the very first case, which you call as primary case, should be excluded from both the numerator and denominator. Okay, the first case should be excluded from both the numerator and denominator. That is very, very important. So, number of secondary cases that develop following the exposure to first case will come in the numerator, and how many were exposed susceptibles, that will come in the denominator. So this will tell you actually about the secondary attack rate is something which will tell you about the communicability of the disease, right? Communicability. That is another MCQ, or how infectious is the disease. If we say that secondary attack rate of, say, mumps, if I'm saying that it is around 70%, that means 70% of those susceptibles who get exposed to a primary case will develop the disease. Around. It's always a range. I'm just telling you 70% means that is what it is. Further, disability rates. Okay, disability means inability to perform a routine function which is normal for a patient's, or not patient, a person's age and sex. So, let's see what are the disability rates. There are mainly 4 disability rates. Before moving into the disability rates, I would like to tell you something about 4 terminologies which are a little bit confusing, looks like synonyms, but they are not synonyms, and you should be knowing the difference between these 4 terms, which are, I'm going to show you a table and I'll be explaining using that table, but each and every cell in that table is an MCQ, each and every cell. Okay, so which are those 4 terms? You have disease, impairment, disability, and handicap. You're familiar with these 4 terms, right? And these 4 terms are very important for your MCQ. Okay, the explanation or the definition as well as examples are important. So you will be given a question and you have to say whether it is coming under impairment, disability, or handicap. When you look from, if you don't know the definition, you may feel that, okay, it could be impairment. No, it could be disability. It could be something else. No such confusion is needed. Just relax, I'll tell you. Okay, so let's see the differences between disease, impairment, disability, and handicap. Dis means, as the name indicates, this means, a negative effect. easiness, your comfort. So something which is affecting your comfort. It's disease. Disease always affect your comfort, right? It is a disorder adversely affecting a person or a group of people. Okay. Now, for example, diabetes mellitus, polio. Now, disease can in turn lead to impairment. Now, what do you mean by impairment? As an immediate case, impairment word meaning means losing something. That is impaired, right? Losing something. What? Either an anatomical structure, as in the case of diabetes mellitus, the patient is losing limb, or a physiological function, as in the case of polio, the patient is not losing limb, but is losing its function. Okay, so either an anatomical structure or a physiological function. Now, impairment can lead to disability. As an immediate case, disability means inability to do a routine function which is normal for a person's age and sex. So, because of which the patient is unable to walk, as in the case of diabetes mellitus and polio. And disability can lead to handicap. Now, what is handicap? Handicap means it has got an extra dimension. That means out of all this, or because of this impairment or disability, the patient is unable to do a routine function. The patient is unable to do a social role which is expected out of him. For example, he's a breadwinner of the family. He should be able to go out and do work which he is unable to do. So he's unable to do a social role is what you're losing in, or this inability to do that social role is what is affected in handicap. I hope it is clear. So unable to do work, losing job, all these are examples for handicap. I hope it is clear. Each of this, cell is an MCQ, and you will also get examples, and you have to write whether it is coming under impairment, disability or handicap. Okay. Is that clear? Now let's see which are the disability indicators. That is the next MCQ. There are mainly 4 disability indicators: DALY, HALE, QALY and Sullivan's index, of which the most important ones are DALY and Sullivan's index. Okay, so let's see what is DALY. Disability Adjusted Life Year is the full form of DALY. Disability Adjusted Life Year. Okay, let me write it. Disability Adjusted Life Years. As the name indicates, here there are 2 keywords. One is disability adjustment. That means how many years someone lived with disability and how many years, life years lost because of premature death. So this is something which will tell you about the burden of disease in the population. And it measures, this is another MCQ, it measures the burden of disease and effectiveness of intervention. And DALY is calculated using 2 things. YLL is years of life lost. YLD is years lived with disability or lost because of disability. Years lived or lost because of disability. This is what you're calculating in DALY. Now let's see one example. Just have a look at this. Are you able to see? Imagine that the normal life expectancy of a person in a particular country is 65 years. Okay. Unfortunately, this guy is dying at the age of 45 years. So how many years he lost because of premature death? 20 years. 5 years prior to his death, he was bedridden with some disease, like maybe stroke. How many years he lived with disability? 5 years. So what is his DALY? 20 plus 5, 25 years. I hope it is clear. This is not exactly how you calculate DALY, because you give a weightage factor for the disability as well, because disability is not the same for everyone. Some people may not be able to get up from their bed. Some people will be able to do their, little bit of job. So what I want to tell you is you actually give a weightage for disability as well, but at your level, just understand this is how you calculate DALY. Okay. Then you have HALE, which is health adjusted life expectancy. Just the full form itself is necessary, health. So as an immediate case, this is something here you are calculating the years lived in full health. Okay, not that important. Then you have QALY. QALY, there you are calculating how many years of quality life that you have added to a person by your medical intervention. Okay, how many years of quality life? Quality means, that is something subjective. Right. And the example on those things you will get in the original video. But for the time being, please do understand that in QALY. QALY means, as the name indicates here, the key term is quality of life. So the question is, it's not just extending the life, but how many years of quality life? That means the patient is also happy. How many years of quality life you have added by your medical intervention is what you're calculating in QALY. And the last is Sullivan's index. Okay, that means life free of disability. Now, how do you calculate it? From the normal life expectancy, you subtract the time or duration that you have spent in disability. So, life expectancy minus disability. Again, all these are MCQs. Okay. And the new name of Sullivan's index is DFLE. In the latest edition Park textbook, you will not find the Sullivan's index. Instead, it is written as DFLE. Disability free. Disability free life expectancy. That is what you're calculating, right? Disability free life expectancy. How many years someone live without disability. Okay. So these are the things that you calculate under disability. So we have 5 mortality measures, 2 morbidity measures, and 4 disability measures. I hope you're with me.